Hello and welcome to the GCI Summit. For this session today, I am delighted to be joined by 5 patient advocates who are at the forefront of campaigning, and really humbled to be joined by these advocates from around the world. We have representation from the UK, from Greece, from Spain and New Zealand. So joining me on this session are these experts, and they are Carola Perez, we have Carly Barton, we have Jacqueline Poitras, we have Abby Hughes and Tori Catherwood. So to kick us off, I think it would be really nice for our viewers to get a bit of an overview as to sort of what led you into cannabis medicine activism. Carly, would we be able to start with you?
Yeah, absolutely. So nice to be here. I'm Carly. I'm a patient myself. I managed to come off, 25 different drugs with cannabis that I was prescribed for really severe neuropathic symptoms following a stroke in my 20s. And cannabis for me completely transformed my existence and, got me out of the house, got me out of a wheelchair, got me moving again, and completely transformed I have a life now, which is great. And from that moment, I first began to really, get a flavour of what this medicine is truly capable of. And I've been campaigning for access, fair access for people ever since. So I was quite involved in the campaigning that brought about the law change with Abby, and also have launched my own projects to help people access and to stop people being criminalised where they can't afford a private prescription in the UK. So at the moment, I'm running a campaign called Can Card, which is about to launch, and that is a project designed with police, MPs and doctors. And it is a medical ID to allow people to consume medicine freely without fear of arrest in the UK. So we've seen quite big changes on the scene in the UK, and we're hoping for more. And I'm not going to stop until we see access in a really fair way.
Thank you, Carly. And Abby, also based in the UK, can you give our viewers a little flavour as to your route to cannabis activism?
Yeah, sure. I think my journey sort of started in the NHS. I was working in operations management from the age of 21, and ironically, I started to get more and more sick. I found a group, United Patients Alliance, who used to do a lot of campaigning in the UK. This is how I met Carly. And yeah, we sort of advocated going and talking outside Parliament to being invited inside Parliament. The law got changed, and now the problem is access still isn't available. So ironically, I got deemed too sick to continue my management role in the NHS, and I was made redundant, which is quite unheard of in the NHS these days. But that's the path they chose. And now I'm well enough to run my own community interest company. So we started earlier this year, PLE, Patient-Led Engagement for Access. We are a non-profit community interest company. We're volunteer run, we're patient-led. We thought it was really important to have patient-led in our name to remind people that, hey, we're patients, but we can be professionals as well. We have had, and I quote, people say, oh, we've seen patients trying to do this and they need help, so we thought we'd do it for them. We don't need you to do it for us, we're doing it ourselves, thanks very much. So yeah, having a platform where patients can come and be part of our community. We want to bring together researchers, academics, clinicians, patients, all different people that are involved in cannabis, and teaching people about the endocannabinoid system and how and why cannabis works is the sort of our goal. And our vision is to see cannabis available to all patients in the UK across mainstream healthcare. So yeah, PLE is run by a really great team of volunteer patients, and I'm really proud of what we've managed to achieve in the short time that we've been around. So.
Awesome. Thanks so much, Abby. And over to Greece. Jacqueline, would you be able to give us a brief overview of how you were led to the plant?
Well, I think it's a pretty common story amongst parents. I'm a mother of a young woman who has pharmaceutical resistant epilepsy. And after 2013, when I first saw the weed video that came out from CNN and the story of Charlotte Fiji, this is when I started looking into CBD as a possibility for my daughter. At this time in Greece, there was absolutely nothing. There was nothing even available in Europe. So through these first attempts of mine to try to reach out to other people to find oil for my daughter, I started reaching out to other advocates as well in other countries. And that started this sort of cross-European interconnection that we really feel is necessary for anything to happen properly in Europe. In 2016, we met up with the minister here in Greece. In 2017, he announced that cannabis will now be legal for medical consumption. And 3 years later, we still don't have products on the market. So MAMAKA, which is my organization, it's a combination of the words mama and cannabis, because we were mothers who first started this organization, but it's now an organization that represents patients all across Greece. And we are still fighting for changes in the legislation and still looking for ways to connect with other patients across Europe. So I think that this is an excellent opportunity today that has been afforded us in this summit to even strengthen ties further and see which way we can actually give a body to the communications amongst all the patients groups across Europe.
Thanks so much, Jacqueline. And a short flight from Greece over to Spain. Carola, over to you.
Hi, thank you, Jonathan. Well, my story began when I was 11 years old and I was skating and I fell down and broke my coccyx bone. Until today, and after 13 surgeries on my back, I have to be laying face down for 15 hours per day, suffer from very severe neuropathical pain. I have 2 overdoses of morphine and benzodiazepines. And cannabis came into this moment when I was asking my parents for help to die because I couldn't deal with the pain anymore. So once the cannabis get into infusing milk in my life, I started I went to Cannabis Social Club, starting to get cannabis there in a more secure way than go to the streets. And then, well, after trying to help some other activists for recreational use to get cannabis regulated in Spain, I thought that it was the moment for trying to get the medical use legalized before, because it's going to be more difficult to get recreational use than medicinal use in Spain. So I founded a patient association in 2014 called Dos Emociones. We have helped more than 2,000 people until today. And also I founded the Spanish Observatory for Medicinal Cannabis in 2015, where researchers, physicians and patients work together in order to change the law, because the Spanish politicians says they're saying that we don't have enough clinical evidence to have cannabis for patients. We only have Sativex, Epidiolex, but we don't have anything else. And as we all know, in Spain, we have these cannabis social clubs and we have these kind of places to go, but they are not the safest places for patients to be. So that's basically what we are doing this, trying to change the law, trying to talk to the media, share our stories, and say to people, please take care that medicinal cannabis use is the same plant as the recreational use, but our needs are more urgent and we need the law to be like faster than the recreational one.
Awesome. Thanks so much, Carola. And last but not least, over to New Zealand and Tori.
My name's Tori. I'm from New Zealand. So I'm a medical doctor and I'm a scientist. I'm also the daughter of a patient who had cancer who had great benefit from using cannabis, and wound up myself having cancer and using it myself as well in the end. But with my mum, that's really when I started the journey, because she had really incredible pain from one of the metastases in her lungs. And she was on such high opiate doses that she had incredible side effects from them. So she really struggled with her pain, and she still had a lot of nausea. She had very little appetite. She wasn't sleeping, and her mood in general was pretty poor. So having a science background and also a medical background, I got in touch with some people and then spoke to my mum about it, and she accessed cannabis. And initially she started just eating it because we obviously didn't have any products at that point that were legal in New Zealand. She had great benefit, and within 3 days her pain had reduced dramatically, and she was able to reduce her, at that time, oxycodone dose by 50 milligrams, which is a dose that would kill anybody who didn't use that. It was a huge dose, and it meant she had way less side effects, and she started to really live her life again. So that for me was a really pivotal moment, and as she used more, she had greater benefits as well. And it really broke my heart that I hadn't been taught about the endocannabinoid system in medical school, and there was no mention in the medical curriculum that cannabis was anything other than abusive and could be misused. So I, with one of my friends, created a documentary called Mum, Cannabis and Me. And the aim of that documentary is to highlight the ethics and the science and the law in New Zealand around medicinal cannabis at that time. And it was quite a journey, and I don't think I could have planned it better if I had tried. But it happened to also be an election year, and it just so happened that with the documentary, I was in touch with a whole bunch of journalists, and they subsequently put a lot of stuff in the media, and it very quickly became an election issue. And so through the documentary, I found myself with the community, and I had inadvertently become, the medical activist for cannabis as a medicine, which was really quite unique. And I was at this time I was a student, so I was one of the first medical people to kind of speak out, and then followed a few other doctors that I knew who were keen, who I didn't put too much pressure on, but just sort of said, hey, like these patients are suffering, and they would really benefit if you spoke out collectively. And they did, and it was really incredible because in the election it did become the main issue, or one of the main issues for the party, who subsequently got in. And it's been a bit of a rocky road because they promised medicinal cannabis, and we have it, but we have a whole bunch of PC laws, and products are still really difficult to get, still really expensive and tricky. So because of that, I've continued my activism, but very much behind the scenes now, where I educate and kind of give create connections between people who can further the recreational side of education and trying to help that law. And now the recreational cannabis use has been so popular in the last couple of years, following the medicinal cannabis law change, that now in less than 2 weeks we have a national election, and one of our main referendums is the legalization of recreational use of cannabis. So I think that it looks like we're going to pass it, which would be awesome, because it would make us the third country in the world. But I think for me and for a lot of the other medical cannabis community, it really would help to just open up that door, because there would be so much more access and accessible products. And it would mean people can legally grow at least 2 plants in their backyard, which they can use medicinally. So I think that would be really awesome. Yeah. So watch this space.
Awesome. Thank you, Tori. And something that you mentioned there, and I'd like to sort of open up to the floor, and that is around education. And I guess my question is here, how important is it to successful campaigns that have longevity and are able to influence change and policy and change of opinions? How important is education to that? And as campaigners, what is the best way to present that education? And maybe one more sort of part to that question. I'm sorry, there's 3 parts to this, but getting a little bit excited here. And I guess the last part to that question is, do you have to position and structure different bits of education to different groups in different ways? I'm thinking, for example, is the education you're going to put to policymakers different to patients, etc., etc.? Who'd like to jump in here?
Hey. I think education is absolutely pivotal. This will be the game changer. This is what will make it change. And when I worked in the NHS, the way I would educate the doctors is, oh, professor oncologist, have you seen this study by this professor oncologist in America? It mentions about the endocannabinoids system and the tumor shrinking properties of cannabis. And I would play it that way. I would never be like, oh, cannabis is great, it's going to help everybody. Because it's not. Cannabis isn't a cure-all. I'm not cured. I have a genetic condition which isn't going to go away with cannabis, but cannabis might help me to manage my symptoms. And I think being realistic in education is really powerful. So PLE actually have just had our first really successful week of awareness, which was Medical Cannabis Awareness Week. So throughout the week, there's all sorts of different events that have been going on. From Medical Cannabis Explored, which is where patients can have a Q&A with the doctor, Dr. Claude Sear, who's a Canadian physician who runs Doctors for Responsible Access. So with him and Dr. Mastracci, who is on our advisory board for PLE, she is the clinical director for vascular surgery at one of London's largest teaching hospitals. So between Dr. Sear and Dr. Mastracci and myself, we'll sort of sit and deliver a Q&A, kind of how we're doing now in a sense, but where patients can submit questions in advance and have them answered live by a clinician. We have clinician events where different clinics sort of can come and send their doctors to learn more. So I think the audience is really going to depend on the education that you provide. And I think most people know someone who is sick or someone who's got a sick child. And by telling stories of real patients, real lives, that is what will educate people. That's what's going to be emotive and get people interested. Oh, it sounds familiar to me. I'm going to tell that story to somebody else. So to me, the education that in that way, I think is quite important.
I wouldn't mind jumping in here if that's right. Yeah, I totally agree with Abby about the stories. I think you know, for policy to change, and that's really what we want. We want policy and law to change here. And that is shifting an institution. And I think you're only ever going to get that once you've got the general Joe public on side. And Carola touched on this a little bit earlier in that, you know, as well as Abby, in that getting patient stories out there. I think actually in the UK, what we saw was a complete 180 when the likes of Billy Caldwell and Alfie Dingley were in the press, and it was about children. And I think that instinct in all of us, even if we aren't parents, we all as adults have this sort of paternal, maternal feelings around children. You naturally want to protect them, and you don't want anything to get, you know, to harm that child. And I think what happened with the press with those kids is it made every person who read that story feel anger about the way that this was being dealt with, and everybody wanted those children to get that medicine and to get better and not to die as a result of their seizures. And I think that changed something here. That changed the general, you know, a lot of people walking around the streets could care about cannabis or don't need to know about it, but the general attitude at that moment shifted. And I think really that's who we need to be convincing. We need to be doing more sort of right-leaning press. We need to be convincing those conservative people that this is something that not only is good for society, but is good for the economy, is good for the future of medicine, is good for the, you know, research, it's good for the planet. And so, you know, it's about, I think as much as it's about tailoring, you know, like David Casseret says when he talks about, you know, educating doctors, you have to talk their language. I think that is important. But I also think that we need to get to a place where we're constantly lifting all of those stigmas that are inherent in the sort of mentality of the general Joe public.
If I can jump in on this one, both Abby and Carly mentioned education in connection with doctors. We're a patients panel here, and there's one thing that I would really like to get across through this patients panel is that up until now, the patients and the traditional users of cannabis have amassed an incredible amount of empirical knowledge around this plant. And we are way, way ahead of the researchers and the doctors as far as the knowledge that we have collected. I mean, even in the period of time that I've been doing this from 2014 up until today, in these 6 years, I feel like I've become a specialist. Now, there's a problem here. The medical community does not want parents and patients and advocates to have a medical opinion. Now, traditionally speaking, I mean, as far as the anti-epileptic medications that my daughter takes, I do have an opinion. I've always been an informed parent. Parents of children with disability are pretty hardcore parents. We know a lot about what is going on with our children. And that's why we fight the way that we fight. And that's why things have been happening with parents leading the way. But that's a little bit off topic. What I wanted to say is this knowledge that we've gathered is something that the medical community should be listening to. So we need a connection with the medical community where doctors are interested in learning what we know, because we know a lot of details that it's going to take them years to get to. And what really concerns me, because I've seen this happen, is when you do not have a properly educated doctor, and I don't mean just necessarily that he knows what's going on with the endocannabinoid system, but the complications of dosing and how specific dosing can be to each person, and how even 1 milligram can actually make the difference in many different cases. These are things that we know. What I'm concerned about is when doctors start to see patients and they don't feed off of this information that we have to give them, we're going to lose patients. And I don't mean lose patients in the sense that patients may die, but what happens many times is because they're not getting the results that they really did truly hope to see, then they give up on it. And for many people, cannabis is their last resort. They got to this point because they've tried every medication that there is, every therapy that there is, and if they get disappointed in cannabis, that's it. They're not going to try anymore. So please, doctors, reach out to the patients. Try to learn from what it is that we know. Thank you.
And thank you, Jackie. And I also agree. And I'm a little bit angry with the CBD industry, because the CBD industry has promised some results to the patients and in the media that they are not true, or they are true in for example, in 600 milligram per day dosing. So I think one of the issues with the patients, I don't know, because we have been doing this work for 5 years, and now all the patients to come to us for help, they have tried CBD before, but some of them because they insist. Because if not, some patient will try CBD oil buying by Amazon and then sell, because as the CBD industry has said that CBD is the medicinal part of the plant. Some patients have tried CBD, doesn't work, for example, for neuropathic pain or nausea or whatever, and they say cannabis is not working for me. So I think the cannabis industry has also a point, the CBD cannabis industry, sorry, because they have been promising some results that we have preclinical or clinical evidence, but with some dosing that is not the same as you are buying in a CBD oil. So I think this is why education, and this is why I'm going to press and share your story and try to explain people what cannabis is and how complex is in the use of the plant. It's our job to do. And when we started our project, only 50% of the population in Spain was in favor to regulate cannabis as medicine. Now we have 84% of the population in favor. So we can, after more than 300 interviews in press, telling your story once and again, going into the deep side of your story, because it's hard to tell. And in the beginning, I was crying in all interviews, and it was really hard for me to open and share this intimacy, no? But then you realize that it deserves and it's worthy. The thing is that we don't have the support. I'm so tired of listening to the industry say we are here because of the patients. But at the end, no one is helping the patients. We are pushing and pushing and pushing. And they said, you have to keep Carola. And you say, yes, but I need an assistant. I need a secretary. I need someone. My schedule is so full. I have so many things going on, and I'm a patient. I need to go back to bed at 5 o'clock in the afternoon for all day. So this is one of the points why I wanted to say that we need to do this, and we need to do this right now, because some of them, we are so tired of being 6 years having the same stops and the same issues. So this is why meeting patients and work together is important, and share our experiences with the politicians, so in the European Union or with the Vienna conventions, whatever. No? And this is why we have to try, because we are also tired and the industry is not supporting us.
I think you've made some really, really good points there, Carola. I totally get that. Having to recount your story over and over again, and I'm sure we've all been there in those
Emotional
events.
labour of that. Sorry to interrupt.
Say again, Abby?
The emotional labour of that. Sorry.
Yeah, totally. I mean, I remember me and Abby did an event, the first event we did in Parliament, and I remember having a piece of paper, and it was literally, I was shaking like that, and having to go through all of the pain of recounting trauma, really, because that's what we're talking about. We're talking about trauma. And you know, this industry has shifted because people like everybody on this panel and many more all over the world have stood up and felt the need to open up and go through that trauma in order to share their experiences to make this better for other people. And so I think we should maybe be giving ourselves a pat on the back a little bit for that. And I know it's tiring. I know it's so tiring. I'm absolutely exhausted. I'm sure we all are. But you know, I suppose things are happening in little steps. And I can't actually think of another, another sort of medical issue that's required so many people to crack open their hearts and stand on boxes and scream and shout and speak to MPs and really open their hearts and their souls and their family's business up, open to all of the press in order to shift things for other people. I mean, what we do is massive. It's really massive.
And what you were saying, Carola, about all the industries are happy to take our stories. They want our stories. They want us to come, no offense, Jonathan, to join panels like this. This is what we do. We spend our lives doing this. So go back 3 years, I was a manager in the NHS. I worked full time. I was busy. I was active. Then I got too sick. Then I managed to build up myself to be active again. But all of my activity is working on medical cannabis advocacy. And that seems bonkers that I'm having to spend my time doing that. So one of the things PLE have done to try and address education is to develop a patient working group where different patient advocates like ourselves are invited to come and be part of our group. And then we've got different tasks. So Carly's CanCard, for example, on the website, there's a list of frequently asked questions. So we're sort of going to put that to our patient working group and say, can you read through this if you've got any feedback? And then the patient working group can share their testimonials. There's different things that the group can do. So we're sort of going, there's us as PLE, but then we represent loads of other patients here. And these are all sort of our advocates helping us, if you like. But every one of them has gone through that emotional labour. And I, Carola, like you, used to spend the panel, I would spend crying because I just couldn't, I was reliving that trauma. And like I said, the emotional labour of having to do that for someone else to understand. And years later, I'm still telling the same story.
I think one of the things that a few of you have touched upon is to do with the relationship between patients and the industry. And I guess in that, I want to sort of open up a question, and that is, how do you see the sort of current relationship between patients, patient groups, and the industry? And what do you think it should be like? What do you think it should look like? Of course, the majority of the cannabis programs that either are online or are coming online are focused around the medicinal side of things, and patients are at the center of that. But, in conversations with you guys each personally and lots of other people, there seems to be a real disconnect between patients and the industry. What should that relationship look like? I feel like you guys are quite literally the best people to ask.
I know exactly what that relationship should look like. It's a triangle. Okay, this is something that I am trying to get across to the industry and also to the scientific world out there. The base of the triangle, at the one side is the scientific world, it's the doctors, it's the researchers. We need this information, we need this to go forward. On the other side of this is industry, who is making money off of our stories. I'm sorry, but that's the truth, okay? We on this panel and all the other activists across the world are out there. They're putting their lives on the line. They're putting their stories on the line. They're going through, and we have to keep in mind that we are all either patients or families of patients. We don't live an easy life. So doing what we're doing is not just somebody who's decided to advocate for cannabis and has nothing else to do in his life. My daughter takes up an incredible amount of my time. I've actually had to hire somebody to help look after my daughter so that I can do what I do. So at the top of this pyramid is the patients. And I'm not talking about just saying, yes, the patients are the most important thing. We are the only reason why we're here. And if industry expects us to continue doing their work for them, because that's what we're doing. We are changing policy, we are educating people, we are educating doctors, we're doing all the work. They must support us. Carola touched on this a little while ago. I mean, for me to do my job properly, I have to stop working out of my living room. I have to stop cooking at the same time as I'm on the phone with the policymakers and everything else. I have to have an office. Secretary. I have to have people working for me who can work on one specific thing. I have one person just beating down the doors of the policymakers. If I'm doing everything, I am not going to be as getting the results that somebody can get who is actually have the support for this. So industry, please listen to us. Previously, I asked the doctors to listen to us. Now I'm going to ask industry. You should be supporting us. You're making a lot of money off of this. There's no reason why each of us have to go begging for money. There should be a certain amount from all of your income, which is put towards supporting the patients groups. And you know what? It's going to pay off because we're going to do your job better for you.
One of the things I'm starting to notice, I know that was powerful and that I totally agree with everything Jacqueline just said. One of the things I've noticed a massive shift in is patients are starting to understand their worth and their value. Like Jacqueline just said, you're making money off me. Why am I sitting here spending my life, giving you my time, my story, my emotional trauma for you to make money off me? This should be, like Jacqueline says, a triangle. It should all be working together. Not, I was in a meeting the other day and the director of a project said, oh, we can use this patient for this, blah, blah, blah. And I said, excuse me, can we just think about the language there? Why don't you engage the patient instead of you don't use anybody? And I was totally taken aback. And I thought, no, I'm going to say something here. I'm a patient giving you my time and my life. Give me something back for it. And I've only just realised the value in my worth. And at PLE, we've started to implement a suggested donation for our time because we all spend our entire life doing this because we want change, because we want things to be better for other people. So if I'm going to put something into your business, you need to put something into mine. And that's how we work now. And that's how I think more and more patients are starting to establish themselves. The problem with that is you then get some patients going, well, they said they volunteer for everything. They said this, they said that. Why don't I get money? Well, we're not wanted money personally for ourselves. PLE, for example, where we have a consultancy fee, it might be a day rate for PLE, and then all the money just gets put back into what we're doing. We're non-profit. We're not making money off this. Just to have something to allow us to have a website to exist, to allow me to run my Wi-Fi and actually have some, not have to use my mobile hotspot so I'm late to a meeting and things like that. We need project management software to run all these things that we do. I need support in that sense. We don't just need money from industry as well. We need actions from them. think so. In Medical Cannabis Awareness Week, we said we don't want any sponsorship. We don't need your money. We can run the week. What we need is actions from you. We need you to run your own events. So we've had different organisations running their own events, and we've put patients in there to help them, but we haven't had any. We've stopped going, we're going to organise everything and run it all for you. We need your support to do that. And that's, I think, been a real game changer for a lot of patients, is that when we don't just want money, we want actions, but we do want money as well.
Yeah, can I jump in there? I think it's amazing hearing those stories. They are exactly how I feel, you know, that cannabis fatigue is what we call it here in Kiwiland. It's from the last election, the people who were kind of at the forefront and pushing that snowball down the hill, we're all very much in the background now. It's absolutely exhausting. And I think that initial step of, you know, going back to that question, Jonathan, education, it's essential, and it's the fundamental building blocks to any informed decision around it. And if people don't have the education around, you know, the truth, then they've got this fear, and it causes that cognitive dissonance, which makes them really resistant to accepting what actually might be going on, and, you know, it really might be benefiting these people like this. And it makes people feel a little bit uncomfortable. And I think in terms of the education, it's really important to structure it to whatever target audience that it's, you know, intended to affect. For example, when I made that documentary, Mum, Cannabis and Me, it was to be targeted at medical doctors, particularly because I could see that none of my mum's medical doctors had any idea what was going on. And yet I was waving all these papers around and saying, look, you know, I've got a background in biochemistry, like just read this paper, you know, just read the abstract. It's pretty profound. And they did listen. It was really neat, but we had to definitely chop the documentary down and target it towards them. And it meant that a lot of the lay people as well found it too sciencey, and they didn't really like it because it was a bit too hardcore. And I think that in terms of targeting it to people, we did find a really good response from that documentary. And then in that community found you know, a whole bunch of patients who then we ended up doing like some really amazing stories, and some other doctors who happened to be family friends who had seen my mum's benefits also happened to be spinal doctors who had patients who would repeatedly come in not on the conventional medications, but when asked would admit to using cannabis. And it really triggered a response in them, and that they decided to do some research. So we did some research and we interviewed 10 patients who had spinal cord injuries and used cannabis to treat their pain. And it was a qualitative study, so we just questioned them. And the themes were pretty much that these patients were going to their doctors to try to get information and products, but then they couldn't get anything from their doctors, so they were then having to be forced to go to the illegal market, which is so inhumane. It's just, I can't believe that that's happening. And I've, you know, my mum's been through that too. But being able to document it in the literature that this is happening, and that this wasn't just one story, it was the same story in all of these patients, whether they had benefits or not, you know, they were all having to go into the illicit market. And I don't think that any medical product that's working with patients should ever force people to do that, because you're engaging with people and it's a harmful situation. And I really feel that the research now is starting to have more of an effect in that it's actually listening to these patient stories. And it's really cool, because now it's almost, rather than a you know, sort of like a hypothesis driven from you know, the unknown, it's more like it's patient driven, because we know we've got all of these stories, and these stories can then drive the research. And I think in New Zealand we're pretty lucky because it's so small, and, you know, everyone's your auntie or your uncle or your cousin, so like you kind of know people, and we can get a little bit of action here, which is quite cool. But I think it would be really awesome if this was happening in other countries, you know, where you had some really open-minded doctors and researchers and patient groups getting together and saying, well, actually, it's really not that tricky to do research. You just get a med student who's doing their elective for the summer, which is compulsory for all of them. And then you know, they do this really cruisy research, but write an amazing paper. And then it's this stamp of evidence in time, and it's pretty powerful. And I think that sort of education is really important, because if we want to influence these people who we're trying to make change in, we've got to speak their language. You know, we really have to take these incredible stories. And I think with the industry, it's a little bit more tricky, because their motive is money, you know. So in terms of that, it's hard. I don't know if I have the answer for the industry. I to be honest, try to steer clear of them.
There are guidelines around working with the industry, and we've been throwing that back at the industry. Some groups we worked with didn't even know the ABPI, the Association for the British Pharmaceutical Industry, have guidelines for working with patient organisations, and we've had to provide that to other organisations and say, are you following the guidelines set by the BPI, which you should be following? Yesterday as well, our advocacy director attended a workshop with the NIHR, the National Institute for Health Research, all around patient involvement, and it was aimed at clinicians and researchers, but patients and public were invited. And it talked about fees being paid, how it's responsible to have patient involvement, and how actually you really shouldn't be doing research if there isn't patient involvement and things like that. I mean, looking back to my time in the NHS, there's no way we would have put a study together or any of the things we were working on without patient involvement. So how the industry can get away with it, it baffles me. But then we're really lucky to be invited to things like this, but it has to be of mutual benefit. And I think that's the big thing that patients need to be aware of, is mutual benefit. Know the value in your story, but know the value in being invited to a panel like this and being able to share your story and find a nice balance between, I guess.
Well, I think we could continue this conversation all day, but unfortunately the clock has beaten us. So first and foremost, I'd like to say to our expert panelists, thank you so much for joining us. You're all fighting the good fight, and in your own ways and your own campaigns, you're all doing amazing things. So I implore you to keep going on with that. And viewer, whether you're a doctor, a patient, or from the industry, if you have any questions, queries, and would like to support any of our patient experts here, I would implore you to jump on the networking app and contact our expert panelists directly. You're able to direct message, you're able to set up meetings, you can even set up video meetings kind of like this if you have questions or queries that you'd like to ask. I'm sure all of our expert panelists would be delighted to hear from you and to partner with you in some sort of way as well. But for the time being, I'd like to say once again, thank you so much to our panelists for joining us today. And viewer, I hope you enjoyed the session and enjoyed the rest of the summit.